hand hygiene provided by washing hands, and I provided privacy. Hi, Mrs. Ajasu. My name is Princess, and I'm a student of United States University. And I'm going to be taking care of you. But before we start, is it okay to get your consent to record this video and put it on YouTube as unlisted so that my professor can view and grade me?
Yes, I give consent. Nice to meet you, Princess.
Nice to meet you too. So when Mrs. Ajasu, can you verify your name and your birthday for me?
Emma Ajasu, and the birthday is 12/5/1971.
Okay, so Miss Ajasu, can you what's your race?
My race is African American.
What's your ethnicity?
Black, not Hispanic.
Okay. So what's your gender preference?
Female.
Okay. So Miss Ajasu, what brings you here today?
I came in today to do my annual checkup.
Okay. So apart from today's visit, is there any other issues you want us to address?
Currently, no. I just came to do just the annual physical. Nothing else bothering me currently.
Okay. Do you have any fevers, diarrhea, any runny nose?
No, nothing like that.
And chills?
No chills.
Okay. So do you have any medical conditions?
Yes. So I do have a high blood pressure and high cholesterol.
Okay. Have you had any recent hospitalization?
None.
Any screening test before coming here?
Nothing other than the eye exam I had last year, but no other screening.
Okay. So have you had any surgeries in the past?
Yes, I had an appendectomy in 2021, and later on the same year I had a total hysterectomy, and also same year 2021, so 2 surgeries.
Okay. So I can see that you did mention that you did have a vaginal hysterectomy. Is there any other problems that you've seen an OBGYN for?
No, nothing lately. That was the only issue I had. And after the surgery, I did my follow-up. And so there's no need for me to follow up with them anymore. And I don't have any problems with that, so far.
Okay. So do you take any prescribed medications right now?
Yes, so I do take 2 medications for the high blood pressure and the high cholesterol. So for high blood pressure, I take amlodipine 10 milligrams every morning. And for high cholesterol, I take atorvastatin 20 milligrams every evening.
Okay, what about over-the-counter medications?
Over the counter, I only just use vitamin C. It's supposed to be daily, 5,000 units, but I'm not consistent. I take it whenever I remember.
Okay. Did you say vitamin C?
No, vitamin D.
Okay, thank you. You said 5,000 units, right?
It's just a
Daily?
gummy one, yeah.
Okay, thank you. Do you take any herbal supplement?
No, I don't use any other thing. No supplements.
Okay. So right now, have you had any immunizations? Have you had your flu vaccine, your COVID vaccine? Are they all up to date?
Yeah, so all those vaccines, all the vaccines I've had up to date. Had like the last one I had was the shingles last year, and my annual flu. So I'm up to date.
Okay. What about tetanus?
I think I had that already. I'm not due to have one because my primary care did not mention that the last time.
Okay. Do you have any allergies to any medications that you know of?
No known allergies.
Or what about food allergies?
Nothing.
What about latex allergies?
No allergies to latex.
What about iodine?
No allergies.
Iodine. Okay. What about any environmental allergies? Do you have any?
I don't have any such allergy.
Okay. Thank you, Miss Emma. So, can you tell me, do you know anything about any of your family history, your parents, and your maternal grandparents, and your paternal grandparents? Do you know any of their histories, health histories?
Okay. Yeah, regarding my paternal and maternal grandparents, they died early, so I don't have the history. I only had that of my parents. I know my dad had issues with high blood pressure, high cholesterol, prostate enlargement, heart failure, and glaucoma. My mom had asthma, hypertension, and
Okay.
high blood pressure.
Tension and high.
I think same. I mean high cholesterol. That's it. Those three.
Okay. So, are both of your parents alive
No, both are deceased now.
at this? What age?
My mom at 69, my dad at 86.
I'm sorry to hear about that.
It's okay.
Okay. So, do you smoke?
I don't smoke.
Do you drink alcohol?
Just the occasional, maybe margarita once in a while. That's it.
When this was the last time you drank alcohol? Last use?
Maybe 3 months ago.
Okay. Do you do any drugs?
No drugs.
Is there anyone in your household that smokes?
No, nobody.
Okay, so right now I am going to ask you some more questions, okay, about your sexual health and practices. We ask everyone when they come in for visits. Okay, so right now, are you sexually active?
Yes, I am.
Okay, how many sexual partners do you have?
Yes, my husband and him only.
Okay. Have you ever been treated or tested for any sexual transmitted diseases?
No.
Okay. Okay. What do you do for a living?
I am an accountant.
Oh, that would be stressful for you. Always.
It is, but I am managing and coping well so far.
Okay, do you work full time?
Yes, 40 hours Monday through Friday.
So, yeah, that's a lot. That's a lot full time. So when you said that at times you get your work is stressful for you, but so what do you do to relieve the stress?
Well, what I do is, my days off, I try to do stuff that I enjoy, such as gardening, going out to eat, take a walk, so I don't stay in that mindset about work, so I can think something outside work. So that helps me cope. So far, so good. I'm coping. Yeah.
That's good. That's good to hear. So, do you exercise regularly?
Not every day, but I try to put in at least 2 to 3 days of walk, every week. Yeah, I do that.
So, right now, tell me about your diet.
With my diet, I think I'm pretty much, aware and not just eating like, and the only thing I need to work on more is to, increase my vegetable consumption. Is because I'm picky, can't eat this, can't eat that. So, but I have a few, like the broccoli, cauliflower that I handle well. So I just have to increase my servings in those. Yeah.
Yeah, that's it. What about your salt intake and your fat intake? Because you do have a history of high cholesterol and high blood pressure.
Yeah. Oh, well, I'm very aware of, the salt and fat and oils. The salt I keep a good eye. I don't use a lot of the canned foods. I prefer to cook, with fresh ingredients. So I'm not using a lot of the processed stuff that is, high in salt due to like the preservatives. So I do my best to, keep a good eye on that, and I bet my taste for salt is not very high just already. So I think I'm faring within maybe what the limit should be. I don't think I'm doing it way over. Yeah. But there's always room for improvement. Maybe I should read maybe labels more. I usually don't because I'm using more the fresh stuff.
Okay, that's good. That's good. So, do you have any trouble sleeping?
Occasionally, sometimes I have like, some sort of sleeplessness, but I just use over the counter Benadryl and once in a while, maybe once in 2 weeks or so, and that helps. Yeah.
What usually cause your sleep disturbances?
Nothing really. I just think, as I'm getting older, this is my thinking. I don't think I need that many hours of sleep. So if I'm not very tired, then if I try to sleep early, then I set myself up to wake up early. So I think what has helped is I have adjusted my sleep time to not sleep before 10 p.m. That way my sleep will be uninterrupted at least to like about 5 or 6 in the morning.
Okay.
So whenever I stick to that, I'm fine. If I go earlier, then I get the waking up in the middle of the night. Yeah.
Okay. That's good to hear.
Yeah.
That's good to hear. It's like you have your own plan.
Yeah.
Okay. So I am going to ask you some more questions. So what about your spiritual preferences?
Well, I'm Christian, not like I don't know, over the top. Just, that's my grounding, and, that's it. Nothing more, where you can seek refuge, stuff like that. But Christian, pretty much.
So is there anything else we have to know about your spiritual preferences that would interfere with your treatment plan?
I know, nothing other than just the affiliation.
Okay. So there are some more questions I'm going to ask. Okay. So I am going to ask you a lot of questions. We will go over your system. Like you can answer yes or no. But like if it yes, I am going to ask you more questions to like explain it more further. Okay. So do you you have any issues with your visions?
Yeah, related to the aging process.
It's okay, I'll wait.
Yeah, related to the aging process, I noticed my near vision has not been great, so now I need to use glasses to be able to read and to see things clearly. But other than that, nothing more with my vision. With my glasses, I'm good.
No pain, no discharges.
Mm-mm.
You know.
No other
Okay.
issues with my eyes.
When was the last time you had your vision checked out?
October of last year.
October last year. Okay. Have you had any trouble with your ears, nose, runny nose recently?
I have not had any problems.
What about your hearing? Have you had any hearing noise loss?
You can hear still well.
What about ringing in your ears?
No ringing.
No ringing. So no aching, no pain in your ears. Do you have any pain in your
No
ears?
pain.
No pain. Have you been having any runny nose recently?
No, none.
Sneezing? Let's move off. Okay. What about your throat? Have you had any difficulty swallowing?
I don't think so. My swallow is still good.
Okay. Okay. So when this was the last time you did had your dental?
Oh, I had my dental not too long ago, a month ago, the routine cleaning. Yeah. I had that.
Okay. So, do you have any chest pain right now?
Oh, I have not.
Not bad, but have you experienced any chest pain?
Not to
Before?
my knowledge. I haven't had anything like that.
Oh, okay. Has your heart been beating very fast? No. What about at night when you sleep? Do you sleep on one pillow or two pillow?
Just one is normal, and I've been using just one pillow.
Okay. Do you have difficulty breathing? Also.
No problems with breathing.
Okay. So, do you have any shortness of breath?
No shortness of breath either.
What about coughing? Are you coughing?
Nothing.
Okay. Have you seen like any changes in your breathing recently?
No, my breathing is still the same, normal.
Okay, so no wheezing, nothing. Okay. Okay, there are some more questions we will go through. So, have you been moving your bowel regularly?
Yeah, somewhat. I get maybe once in a while constipation, and I just use over the counter. I have the Sana product, and I just use that if I think, but that's a rare. It's like every once in a month or so if I feel something like that.
Okay. So any abdominal pain?
No.
Okay. Do you have any history of any hemorrhoids?
Oh, yes, I have history of that. But it doesn't bother me unless if I get constipated. So that's why if I sense that, then I take the Sana to prevent that.
Okay. So do you have any history of bleeding?
No bleeding hemorrhoid. No.
Okay. What about, do you have any history of any acid reflux?
No.
Okay. Do you have any history of cancer in your family? No. Okay.
History.
Okay, nothing. So, right now, do you have any pain in your joints? or like difficulty walking or like doing any activities?
I don't have pain per se, but in my knees, especially my left knee, had issues, with discomfort, and x-ray showed that I have some arthritis, or they call it degenerative joint disease. But I know my limits. The discomfort is more with incline, so I know that to be climbing up. I have stairs in my house, that's it. But I'm not the one to hike and do those high incline stuff. So I just stay away, stay on level ground, and I'm fine.
Okay. Have you experienced any incontinence, like urinating frequently, pain in your urine, or blood in your urine?
No.
No. Okay. Have you ever been diagnosed with urinary tract infection that you know of?
Yeah, I've had maybe about 2 episodes of that. I don't know. So many years apart. Yeah, I've had that, and not too long ago, I had the UTI and got antibiotics for that.
Okay. Okay. And this thing, you did completed all your antibiotics, right?
Yes.
Okay. Okay. When this thing was the last time you did had that?
The UTI will be like about 3 months ago.
Okay.
They gave me the Keflex, 500 twice a day.
Okay. So, when this thing was the last time you did had your menstruation?
That would be somewhere in maybe October of 2021. That would be the last one before the hysterectomy.
Okay. Yeah, that's true. Okay. Okay. So, so when this was the last time you did your breast exam?
The breast exam, I try to do that like every last day of the month. Yeah, so there's nothing going on. So there's nothing. My mammogram, I'm not due yet. So yes, it's just the self-check every end of the last day of the month. Yeah, I try to do that. Yeah, but my mammogram won't happen till July.
July. Did you had your mammogram last year?
A year before? Yes. Yes, in
Okay.
July.
Okay. And you are now scheduled for this July?
Yeah, so I schedule again to do the next one July this year.
Do you remember the date? Do you know the date?
I just know it's somewhere in July. Yeah,
Okay.
but I don't know the exact date.
Okay. Any pain or soreness in your breast? That's it. Any lump or any changes that you know?
No lumps, and I haven't noticed any changes either.
Okay. So, do you have you been experiencing any headaches, or do you have any history of headaches? Okay. What about seizures? Have you had any seizures, or you have any history of seizures?
I'm not experiencing anything like that.
Okay. Have you noticed any weakness in your extremities or your hands that you know of?
No weakness.
What about memory loss?
I guess my memory is fairly good. I haven't noticed any lapses yet. So I will consider it to be fairly good.
Do you have any depression, anxiety?
Nothing like that.
Okay. So do you check your weight regularly?
Yeah, I do. I do, yeah. I know the last time they weighed me 144 or so pounds. Yeah.
Okay. how is your weight now compared to the to your last year weight?
I would say, I've calmed down a bit, because I thought I was almost 149, 150. And as they say, hysterectomy means you're carrying extra weight of fibroids. So I think I've noticed that since the surgery, I've been kind of like gradually going down, and I've come, I think, down about 5 pounds, so, and I just make sure I keep a close eye, not eat late at night, and I guess that's helping too. I'm a little bit, I don't know if I'm over, based on the BMI, maybe kind of borderline. So I'm working on that to get myself either right on it or below that number. I forgot what exactly I should be, but I know I'm a little off. Yeah.
Okay. So, do you know if like you bleed easily? Like, do you have a history?
Well, like meaning brushing your teeth?
And
No, I don't have any such issues. No.
No. Okay. So, how will you rate your overall health right now?
I say my overall health, is good. It's like with my, diet and weight, trying to make sure I don't step weight out of the ranges, and, sticking to my medicine, taking them, and keeping my blood pressure and cholesterol under control, and with fair activity, with the walking. I think overall I feel good. So far.
So will you rate it as excellent?
Now I will rate it as good.
Good. Okay.
Not excellent.
Okay. Good. So when this was your last time you saw your primary care provider?
Oh, my last time was July of last year for the annual checkup.
Okay.
But I was there 3 months ago. That was just regarding the UTI. Yeah, so.
Okay. So that was 3 months ago. Okay. Okay. So when did they do any labs, any?
Yeah, with my annual physical, they did.
And do you know what labs?
Oh, well, they ran one for the kidney, they did one for blood sugar, and the cholesterol, or the breakdown with your good and bad cholesterol, and the numbers came back good. And and the one for the diabetes was also normal. So
okay.
Yeah.
Okay. So for your medications right now, do you have enough medicine for your blood pressure?
Yeah, so I have still a good amount of refill until I will see them again soon, if for the next just follow up before the annual checkup again regarding the medications, and to see if I need any more lab works or not. Yeah.
Okay. So so before you leave today, the plan is I will give you some labs to go and do, and also to give you some educational materials to read about your hypertension and your high cholesterol. Okay. To know what kind of food to avoid. Okay, your food intake. Okay, your salt intake and your fat intake. Okay. So I will do that before. We will print out the information for you before you go.
Okay, that's good.
And thank you very much for coming in.
All right, nice talking to you.
Okay.
And hope to see you more in the future.
Yes.
On a good note.
Yes, come back and visit us.
Okay.
So this is the end of my health history assessment. Thank you.